mounting array of research into early childhood development is showing us that the 9 months in the womb before a baby is born and the first 2 years of life after birth is an absolutely critical time in the child's life. Unfortunately, not all children get the same level of care and support during this pivotal time. For the past 10 years, the Healthy Start initiative of the Louisville Metro Department of Public Health and Wellness has been working with babies and their families in neighborhoods throughout West Louisville. The program has made a real difference in the lives of babies, their mothers, and their families. On today's show, we'll take a look at the work of the Healthy Start program. Then we'll talk to two moms who've been benefited from the program. We'll talk to Marnita Benford and her son, Jaden. We'll also talk to Gergana Dinkova and her daughter, Iris. We'll also talk to two members of the Healthy Start staff. Nazia Assef and Ryan Irvin will tell us what the program has accomplished and what its plans are for the future. So stay tuned. We'll be right back. Every baby deserves a healthy start in life, but some don't get that chance. Across America, African American babies die at twice the rate of others, that is, infant mortality rate, before their first birthday. In many West Louisville neighborhoods, that is also the case. Many West Louisville babies die before their first birthday, at twice the rate of others. These babies may be born to mothers who don't get early and regular prenatal care, or they may be born into situations where they don't get their health care needs met during the first critical year of life. But the Louisville Metro Health Department is doing something about this. The Healthy Start initiative seeks to close the gap in infant mortality between minority populations and the rest of the community. It seeks to give every baby in our community a healthy start in life. Begun in Louisville in 1998, Healthy Start is a program that targets specific neighborhoods in West Louisville. Healthy Start is a neighborhood-based initiative that goes into the homes of families and children that they serve.
Hi, Miss Donna. How you doing today?
I'm Donna. Thanks for letting me come in.
Healthy Start offices are located in the Bridges of Hope Neighborhood Place on Algonquin Parkway, in the Ujima Neighborhood Place, in the Duval Education Center on Bond Avenue, and in the Northwest Neighborhood Place located in Shawnee High School. Being part of the neighborhoods that it serves gives Healthy Start a real leg up in reaching young women and their families. Community events make the services of Healthy Start known throughout the neighborhood. Community word of mouth is a big factor in letting potential clients know the benefit of Healthy Start services. Community trust makes Healthy Start a credible force in the lives of children and families throughout the neighborhood.
Healthy Start is just a great program, and I recommend everybody getting it. And then I also like the fact that it's not just for women and children. I mean, you know, if you have a boyfriend, a fiance, a husband, he's also invited to be involved. And that's why I really like the program because of that. I like everything. I like the Christmas parties. I like getting to have the home visits because I know at one point in time, if I didn't have those home visits, I probably would not have survived. Just having that person come to your house and be able to sit with you and talk to you about anything you want to talk about, that helped me out a whole lot.
The most helpful thing for me with Healthy Start was after I had gave birth to my son, Bryson. I was trying to breastfeed. Healthy Start was pushing breastfeeding. Ordinarily, I wouldn't even been interested in breastfeeding. I contacted Healthy Start, and Ms. Rec gave me the name of a person who was a lactation consultant. One day, the lactation consultant came into my home. She was there for at least 3 or 4 hours. I was worried about if my child was getting enough food to eat because I felt as if he was still hungry. She said, "Don't worry about it. Your child is not having any problems, Mom. I think perhaps it may be you, just worried." However, I am a first-time mom, but for that lactation consultant to come into my home, to spend so much time with me, that was the greatest experience I have had with Healthy Start.
Neighborhood Place, can I help you, please?
Many other agencies and programs, such as the Kentucky Cabinet for Health and Family Services, WIC, and the Passport Health Plan, also refer pregnant women to Healthy Start.
Sometimes clients just have questions about what they're eligible for, if they have young children, or they're thinking about having children, we still refer them. They find it very helpful because they get a lot of things they need as they're going through their pregnancy and also after they deliver. items they need for their babies. By Healthy Start having a store, they win coupons, and they can use those coupons to shop in the store. So it has been good feedback, and it's a good program, and I think our clients are pleased with the program.
Once a woman signs up for Healthy Start, a nurse goes out to the home to do a prenatal assessment. She assesses the health of the mother and of the needs of the family. The nurse makes sure that the soon-to-be mother makes arrangements to deliver her baby in a hospital. Being in the home also gives the nurse first-hand knowledge of the environment that the new baby will be born into.
I think the relationship we build with our clients, coming into their home, they open up more, and we can find, they kind of share what they need. So we're able to do other resources, getting them transportation, getting them to the doctor, making sure they're on WIC, make sure they're applied for their medical care, and those type of things. Some of the reason people may not get prenatal care is they don't have medical insurance or a provider. They don't have transportation to get there. And then sometimes they don't know they're pregnant, they may be in denial. So that causes them not to go to the doctor. Prenatal care is so important to give her a healthy baby and to have a healthy outcome for herself.
This is my first pregnancy, so, I'm kind of need help on some things. I received a lot of pamphlets and worksheets that tells me about the program, things that I can receive, the coupons. I learned about the baby store, the Healthy Start baby store, parenting classes, just a lot of different things that I didn't know about. They're not getting in your business. It's a confidential program. When they come out to you first for the initial visit, they just want to ask you questions so they can know you better.
After the initial assessment from the Healthy Start nurse, the soon-to-be mom is assigned to a resource family worker. The resource worker makes sure that the expectant mom has a regular health care provider and that she keeps all her prenatal appointments. There may be barriers to keeping appointments, such as a lack of transportation or childcare. Through referrals and direct services, the resource family worker helps the soon-to-be mom overcome these obstacles.
I brought you some TART tickets.
Thank you.
Now, you still catch the TART to
School,
school?
everywhere, basically.
Everywhere. Okay. When we come to their home, it's a service that we're providing to them, saying, thank you for allowing us in your home and for being there for our visit. It's just a convenience all around for them. It's easier for me to pack up and come see her than it is for her to pack up and come see me.
The resource worker visits the Healthy Start client once a month in the home. These visits give the expectant mom and the worker a chance to discuss the development of the new baby and what to expect during pregnancy. The resource worker and the soon-to-be mom discuss proper diet and vitamins to prevent birth defects and the importance of a healthy lifestyle during pregnancy, such as staying free of cigarettes, alcohol, and drugs. After the baby is born, the Healthy Start nurse does another in-home assessment of the new mother and her baby. The resource family worker makes sure the children get their well-child physical examinations at the appropriate time and that all their immunizations are on schedule.
I was 18 at the time, and I was 17, and I was just having a lot of problems at my home. I was living with my grandmother, and I basically went there to the neighborhood place, and they talked to me, and it just seemed like we clicked real good.
Healthy Start mothers and babies have access to many other services. Some Healthy Start moms might be helped to find childcare or financial assistance for emergency situations. Some might be helped to find decent, safe housing.
WIC as a secondary.
Others will get supplemental nutrition services through WIC and other health services through Passport. New mothers may also take advantage of breastfeeding or smoking cessation classes. Infant car safety seats are also available to Healthy Start families. Some new mothers may be helped to find the necessary resources to continue their education or even find a job.